Good morning. I'm Dr. Hudson from Highland Park Animal Hospital, and I would like to help you better understand dog spaying and neutering. My assistant Matt will be helping by asking some questions, and I hope we're able to help you learn about why dog spaying and neutering is such an important topic.
Dr. Hudson, what is the difference between dog spaying and neutering?
Generally speaking, spaying and neutering it refers to removing the sex organs in a dog. Generally speaking, we use neutering to in reference to males and spaying in reference to females. But in some other countries, in Europe and elsewhere, neutering is actually used interchangeably, just as the surgical procedure for sterilization of both a male or a female.
What are some possible conditions that can be helped by spaying or neutering my dog?
Some possible conditions that can be helped by spaying or neutering your dog. In reference to males, we can often improve some marking characteristics, so wanting to mark their territory, some behavioral issues that can sometimes be testosterone driven. And then lastly, there is a significantly higher incidence of prostatic disease, and then furthermore, prostate, which can lead to prostate infections, which can be a medical emergency and often require an emergency type surgery for your pet. In reference to females, some of our most common ones is, of course, unwanted heat cycles, breeding, males wanting to get into your yard or showing interest in the female, extreme interest. And then lastly, some internal issues. So there's a significantly higher incidence of mammary cancer in female dogs that are intact, and also an emergency type situation called a pyometra, which is the medical term for a infected uterus. Of course, that is prevented by spaying a female dog.
What will my veterinarian need to know about my dog before spaying or neutering?
So our biggest things that we will need to know are the previous health issues, of course. The other thing would be the age of the dog. Age of the dog is very important in timing the spaying and neutering of pets. There is a lot of studies saying that spaying and neutering is beneficial at a more older or mature age. So, at a minimum, we want dogs and cats to be 6 months old before doing the procedure. But for our larger breed dogs, say like a Labrador or a German Shepherd, or especially a Great Dane Bernese Mountain Dog, we want them to be 1 year to even a year and a half or so before we get on the schedule. Of course, discussing any other behavioral concerns if we feel like those might be hormonal related. Of course, discussing those concerns on that visit will help us to determine if spaying or neutering would be helpful with that issue.
How long will it take for my dog to recover from being spayed or neutered?
So in general, the recovery is not too bad for neutering a dog, or for a sterilization procedure on a male dog. We expect 7 days of recovery. Those first 5 days are the most important. Ultimately, they should be taking it pretty easy. No long vigorous runs, no dog parks, playing frisbee, stuff like that. We should leash walk to go outside, go potty, and then come back in. And then for female dogs, since you do have to go into the abdomen for the procedure, the recovery is a little bit longer. We say generally 7 to 10 days, so just a few days longer. Same things. We want them to be taking it easy, no baths, no swimming in water, keeping the area clean during their recovery period. So ultimately, for a male dog, 5 to 7 days, and then for a female dog, 7 to 10 days.
What care should I be prepared to provide at home while my dog is recovering from their spay or neuter surgery?
Ultimately, the at-home care for recovery for a spay or neuter surgery is actually pretty minimal. Your biggest things you need to worry about are keeping them calm. Often we will give medications if we feel like keeping them calm is needed. Staying calm is one of the more important ones, especially with a female dog. We need them to stay calm after a spay surgery, just like any abdominal surgery. The more active they are, the more of a risk of developing a hernia at the surgical site, which does require a second surgical procedure to fix. Other than that, it's keeping them comfortable. Of course, no baths or swimming until they're fully healed up. Most of the surgical techniques we use are what we call an intradermal suture technique. So you actually won't even see any stitches. There's no follow up for suture removal. They just dissolve on their own over the coming weeks. So ultimately, the recovery at home is mostly just keeping them comfortable and calm during that window we had discussed earlier.
Great. Thanks for your time, Dr. Hudson. I appreciate your information.
If you have any questions regarding getting your dog spayed or neutered, ultimately please reach out to us and give us a call. We're here to help you.